Namaste everyone, I am Dr. Amit. Welcome back to our YouTube channel at the rate Dr. Amit Official, where we simplify medical concepts for you. So if you haven't subscribed yet, make sure to hit the subscribe button and be a part of this learning journey. So in our last video, we discussed about volume of distribution. In today's video, we are moving forward in our pharmacology series to learn a very crucial concept of clearance. So this is also a very high topic for your USMLE exam, PG exam and MBBS professional exam. So I'll break it down in a simpler and clear way and a very exam focused way so you can understand it easily. So let's start our topic, clearance. So in the end, we'll try to understand clearance with this figure, okay? And so follow on YouTube, that Dr. Amit Official, okay? So now let's start the topic. So let's understand clearance, okay? So while understanding it in a simple language, clearance tells us how efficiently, okay, remember this word, how efficiently the body removes drug from the plasma, okay? So whenever we take any drugs, it goes into the blood or plasma, and from that plasma, how efficiently our body is removing those drugs, that is called clearance, okay? So if you have to define this, then the volume of plasma cleared of drug per unit time, okay? In unit time, what's the volume of plasma is getting cleared from the drug, okay? That is known as clearance, okay? Suppose this is the volume of plasma, okay? And this is full of drugs. Then how much volume of the plasma is getting cleared in per unit time? Suppose in per unit time, this much is plasma is getting cleared, so this much will be the clearance. Suppose this much is getting cleared per unit time, then that will be the clearance, okay? So just think it as the blood is a moving river, and the organ like liver and kidney, which helps in clearance, is a filter. So our body is a water filter system, okay? Now in water filter system, if the volume of plasma is getting clean fast, okay, then we'll say the drug has a high clearance. If the cleaning is slow, then we'll say that the clearance rate is low, okay? Now we'll talk about what are the major organs help in clearance. So the major organs that help in clearance are kidney, liver and others, okay? So kidney is the most important, okay? So it helps in the clearance of the drug, okay? Then how liver? So liver will do metabolism of the drug, and that it helps in clearance, and others like lungs and bile, okay? Now what's the clinical importance, okay? Now we'll talk about what's the clinical importance of this clearance, why we are focusing on this clearance. Because this clearance, the rate of clearance will help us in dosing the drug, how much drug we need to give, okay? Suppose if any drug is very toxic and its cleaning rate is also slow, then if you'll give high dose, then it will produce more toxicity. Then that's why this clearance is help us in dosing the drug. Then how frequently we can give that drug, okay? So the frequency of the drug and the rate of drug accumulation in the body, okay? Now we'll think like, if our kidney fail, or if any patient's kidney is fail, then the clearance rate will be low because the kidney will not work properly, so the drug accumulate and it produce toxicity. So in those conditions, we need to dose, how much dose we need to give for the kidney fail patient. So it's all depend upon clearance. In the same way, if any patient has liver disease, then also their clearance will be low. Why? Because their drug metabolism will be low, okay? So in those conditions also we need to give the appropriate dose. So in that condition also clearance helps, okay? Now while talking about the formula of the clearance, it is rate of elimination of drug where from the body by plasma drug concentration, okay? So we can also say that volume of distribution means how the drug has been distributed in the entire tissue into K, that's a elimination constant, okay? So this is all about clearance, okay? Now we'll see the figure. So now let's talk about this figure, okay? So before understanding this figure, don't forget to subscribe my YouTube channel at Dr. Amit Official, okay? So now let's talk about this figure, okay? So you can see there's suppose any drug has high clearance, okay? So if any drug has high clearance, then all the organs like liver, other organs, everyone is working fast, okay? So that the drug metabolism will increase and the excretion rate and metabolism rate will be fast, okay? So that they can clear the drug very fast from the body. Everyone is active over here. But when you'll see here, if the drug has a low clearance, okay, drug clearance is only 10%, so it means there will be accumulations of drug in the body. Okay, so you can see in this figure everyone is in sleep mode. Okay, so no one is active over here. Okay, so everyone is like let's chill. Okay, so maybe I will clean one car in an hour. Okay, so there will be low clearance. Okay, so in these conditions the drug will accumulate in the body, it will produce more toxicity. So we have to give the dose, we have to make the dose as per the clearance rate of the drug. Okay, so this is all about drug clearance. So that's today breakdown on clearance. So thank you for watching. If you like this video, so please do share it with your fellow medicos and with your friends, and don't forget to subscribe my YouTube channel at the rate Dr. Amit Official. So we'll again meet in the next video. Thank you.